Hello, welcome. I'm Dr. Darren, family medicine physician, and today we're doing health education on topics that you want most. This video is on the GLP-1 agonists like Ozempic. The GLP-1 agonists are the most effective weight loss medicines available today, so this is a really important topic that you need to know about. We're going to be covering what these medicines are, how they work, the possible side effects, and how to use them effectively for healthy weight loss. Basically, I'm going to go over all the important things that I discuss with a patient when I prescribe GLP-1 agonists. Now, if you like content like this, be sure to subscribe and leave a comment down below letting me know what health topics you'd like covered in future videos. In addition, if you have any questions, leave them below and I will answer all of them. Now, before we get started with the GLP-1 agonists, remember that these videos are for education purposes only. I cannot give personalized medical advice here. So if you're having any symptoms or if you're interested in being prescribed a GLP-1 agonist like Ozempic, make sure that you talk to your doctor right away. Now, let's get started with the GLP-1 agonists. GLP-1 stands for glucagon-like peptide 1, and this is a naturally occurring hormone in the body that plays a role in digestion and metabolism. The GLP-1 agonists are medicines that mimic the effects of that hormone in the body. The most popular GLP-1 agonist is Ozempic, and this is also the one that I have prescribed the most. GLP-1 agonists like Ozempic are very effective for healthy weight loss, but they're also prescribed to treat diabetes, and they're also sometimes prescribed for cardiovascular health and to protect the kidneys. Now, let's talk about Ozempic, which is semaglutide. Ozempic is a once-a-week injection, so a lot of patients find that convenient. Ozempic helps you to achieve healthy weight loss by causing several changes within the body. But the most important thing that Ozempic does is that it makes you feel less hungry. The best way to achieve healthy weight loss with Ozempic is to have a healthy weight loss plan in place. So what does that look like? I recommend that you get a notebook and write down your healthy weight loss plan. Make it detailed. Write down what you're going to eat, how much you're going to eat, when you're going to eat, and write down how you're going to exercise and when you're going to exercise. The more detailed it is, the better. When you read over your healthy weight loss plan, it should make you feel that you're definitely going to achieve healthy weight loss as long as you follow everything that's in this plan. For most people who are trying to lose weight, this is where it can be a struggle because the less they eat, the hungrier they get, and the more they exercise, the hungrier they get. So it's hard to stick with their healthy weight loss plan. But if somebody is prescribed Ozempic, they're going to have a definite advantage because they're going to feel less hungry. So they will be more likely to be able to achieve their healthy weight loss plan. A good goal when it comes to healthy weight loss is to shoot for 10% of your body weight over the course of 6 months. For example, if you weigh 200 pounds, that means your goal should be to lose 20 pounds over 6 months. When you do the math and you calculate how much is that per month or how much is that per week, it really isn't that much. It means that you don't have to starve yourself. You just need to make some healthy changes and stick with them. Now, when we prescribe Ozempic, the starting dose is 0.25 milligrams, and the instructions explain that after 1 month, this should be increased to 0.5 milligrams. 0.5 milligrams is a good dose for most patients to achieve their healthy weight loss goals, but if necessary, we could increase it. So if you're at a particular dose of Ozempic and you're tolerating it well, but you're not losing weight at the rate that you're expecting, we might increase it from 0.5 milligrams to 1 milligram or to 2 milligrams. Overall, the GLP-1 agonists are very safe, but there are risks and possible side effects. Most people who take Ozempic do not experience any side effects, but for those who do, The most common that we see are GI related. It can cause bloating and it can cause diarrhea. If people experience these GI side effects, they tend to go away on their own as the body gets used to the medicine. Now, that being said, there is a long list of possible side effects from Ozempic. Some of them are serious, but almost all of them are rare. So it's important that you listen to your body while you're on Ozempic. If you develop any symptoms on this medicine that you weren't having before, be sure to talk to your doctor right away to figure out if these symptoms are because of the Ozempic. If you are experiencing side effects from Ozempic, they will go away shortly after stopping the medicine. While on Ozempic, it's important to monitor your healthy weight loss, and I recommend that you do this with a calendar. Start with your goal of losing 10% of your body weight over 6 months and calculate how much that should be per month and per week, and add these numbers to your calendar. That way, on any given day, you can determine if your weight is where it should be in order for you to achieve your goals. If you're not losing the weight fast enough, think about your healthy weight loss plan and see how you might make it more aggressive. On the other hand, it's also important that you don't lose the weight too fast. If you're losing the weight too quickly, you're likely to become dehydrated and you're going to get sick and you're likely to experience rebound weight gain. How long should you take Ozempic? I recommend that you start by taking it for 6 months. At that time, we check your vitals and check your weight and see what you've achieved. If you were successful in losing the 10% body weight over 6 months, then that's fantastic. And then we should look at where your weight is right now and decide if you would benefit from being on the Ozempic for an additional 6 months. On the other hand, if you did not achieve the 10% healthy weight loss over 6 months, I would recommend stopping the medicine at that point, as overall this plan is not working and we should try coming up with a different healthy weight loss plan. I'd like to make a note regarding insurance coverage. The GLP-1 agonists are expensive. When Ozempic is prescribed and it's not covered, it could cost upwards of $700 or $900 per month. So if your doctor orders a GLP-1 agonist for you and you go to pick up the medicine and it turns out it's going to be very expensive, I recommend that you talk to your doctor and see what they can do. It might be that the diagnoses used for this medicine need to be adjusted in order for the medicine to be covered. Or it might mean that the particular GLP-1 agonist that was prescribed is not going to be covered, but there's a different one that will. Some patients who are ordered Ozempic, it won't be covered, but Wegovy will. Some patients who are prescribed Wegovy, it won't be covered, but the Mounjaro will be covered. So basically, if you need to pay a lot of money for the medicine, talk to your doctor to see what they could do to make the medicine covered. That's it for today. Thank you for watching. Be sure to subscribe and leave a comment down below about any health topics that you'd like covered in future videos, or if you have any questions. Remember, these videos are for education purposes only. So if you're having any symptoms, or if you're taking a GLP-1 agonist, or you're looking to be prescribed one, make sure that you talk to your doctor right away. Bye-bye.